Hey guys, Dr. James here, and I want to talk to you quickly about Western acupuncture. I'm going to address a couple of common questions we get around acupuncture. For example, what is it? What does it feel like, or does it hurt? What does it do, and how does it work? Or will it work for me? Western acupuncture differs from your Eastern style, your more traditional style, as it focuses more on your muscular system as opposed to the meridian points. There are, however, some crossover points. To begin with, most people have never seen an acupuncture needle. So here, let's have a quick look at one. So the needles used here at Little Sprouts and most places are single use. And they come in a pack like this. So if we open it up, it comes in a little plastic guide tube. This helps us get it in the right place and helps us control it accurately without touching the needle itself. And the plastic tab at the top here is there to hold it in place until we're ready to go. So once we pull this out, it's ready to go. Now, if I pull it out of your guide tube, you can see the needle is extremely fine. We usually use something that's either 0.3 or 0.25 of a millimeter thick. The brass handle here is all that I hold onto, and then this is the bit that we use there. Now, the idea of holding the needle is it stays nice and clean, and it's solid steel. We can't inject anything with it. A lot of people will ask if it hurts, and that's actually a very difficult question to answer because that varies on a few different things. So for example, your physical sensitivity to needles, the location that we're putting the needle in, the nature of the condition we're helping you with, whether it be acute or chronic, and sometimes how big a trigger point is that we hit with the needle. And again, what style of needling is being used. And that's just to name a few different options there. Some people say that they don't feel anything most of the time, and some feel a little sting as the needle goes in, but this usually goes away pretty quickly. Often people feel the muscle twitch or flicker as the needle hits a trigger point, or they might feel a mild but deep ache. These are actually really good things with needling. We always ask for feedback as we go along and putting the needles in to help us make sure that we don't need to move the needle, take it out and replace it, or just to a different location in general. So what does the needle actually do for you? It does a couple of things. It encourages blood flow into the area around the needle, usually about 1 centimeter in diameter all around it. It also relaxes those tight or taut bands of muscles that you often feel in the muscle belly, and these are your trigger points. It also causes a few different chemicals to be released by your body. Most of these are helping your body reduce your pain levels in general and help you feel a bit better about it as well. With all of these, we're aiming to increase your function and decrease your pain levels. Lastly, will it work for me? If you want to find out a bit more, if it could help you and in your health journey in particular, speak to myself or one of the other chiropractors here at Little Sprouts who will help you assess and have a look at your case on an individual basis to see if acupuncture would be appropriate for you and go into more detail on what to expect. Thank you very much, guys. Have a great day.